Hello everyone, welcome to our today's episode on trying to understand some of the common lab tests that we do in a clinical lab that your doctor will request you to go and test in the laboratory. In our today's episode, we are going to focus on inflammatory markers. Inflammatory markers. Inflammatory markers are just markers of an inflammation. And when does inflammation occur in your body? Inflammation arises when your body is attacked. Attacked by an infection, attacked through an injury like accident, or attacked internally by your body's own antigens. So when your body is attacked, you will respond by trying to fight the enemy, and the enemy here is the strange antigen that is trying to bring some abnormalcy within your system. So your body will respond by trying to protect itself. So we'll send a series of fighters, and that include some of the immune cells, things like the white blood cells. Some you have in the white blood cells, some you have things like macrophages. They try to do things like phagocytose the antigen that's trying to cause an injury. So generally inflammation will arise in that process where we will feel some sort of pain, redness, some sort of swelling, and some heat will produce during that process. So when you feel such kind of pain, just know that your body is trying to attack the enemy that is trying to cause some discomfort to you. So these inflammatory markers help us or help the doctor to know whether the infection is there or not, and to know whether the infection is severe or not, and also to guide them maybe during treatment, to monitor your response to treatment. So inflammation is just like a defense, a natural defense in response to injury, infections, or irritants. Its main purpose is just to eliminate, cause repair, and restore tissue balance. So inflammation can either be protective or harmful. When it is protective, when it is protective, that is when it is controlled. It tries to cause healing and fight the infection. But when it is harmful, this arises when the inflammation prolongs, and that is normally an indicator of a chronic disease or an autoimmunity. An autoimmunity is whereby your body trying to attack its own self. So this inflammation is what the doctor monitor using the inflammatory markers. That's why you will order this test to try and guide him on whether you have the infection or not. So you order tests like the CRP, ESR, etc., as we'll see later in these episodes. So these inflammatory markers are just substances that are in your blood. They are normally under normal circumstances up to a certain level. But when your body is attacked and there is an inflammation, their levels tend to rise. And that helps the doctor to come up with a conclusion that you indeed have an infection. They are not disease specific, so you can't just say that this inflammatory marker is specific to this infection. They just guide the doctor to help him understand that patient so and so indeed have an infection. So we need to do other investigation in order to come up with a specific infection. But there are screening tests to confirm that you are indeed ill and you need treatment. Treatment includes trying to investigate what is causing the infection. So they are used infections and monitor infection, autoimmune diseases, things like cancer, and some chronic illness. So inflammation markers are normally quite a number, but so many, but the most common ones are normally like 3 that will most commonly be tested. That's why we have the C-reactive protein as one of the inflammatory markers that is commonly ordered. We have the procalcitonin, a commonly ordered inflammatory marker, and we have the ESR, a common test that I know most of you have come across in one way or the other. So to begin with, we're going to have a brief discussion in each and every one of these inflammatory markers. So when we begin with a C-reactive protein, this is just a protein that is produced by the liver into your blood system. Its normal range is normally below 10 milligrams per liter of blood, that is. So when the levels exceed 10 milligrams per liter, the doctors automatically will know that you have an infection. So maybe more investigation need to be done to find out which kind of infection is high. C-reactive protein can rise mildly or it can rise highly. So it can be high over 100 or over 150 milligrams per liter, or it can mildly rise like 20, 30 milligrams per liter. When it rises just mildly, it just indicates that you have things like chronic conditions. You have maybe obesity, you are a smoker, but when it is highly raised, things like bacterial infections start to be suspected. Things like severe inflammation start to be suspected. And remember, inflammation is caused by infections, injuries, and many more. Just the normal inflammation that you know. And C-reactive protein is a good one for monitoring response to treatment. So when we found, for example, your CRP is at, say, 100, and you are placed on treatment, taken your first dose, second dose, and start reducing to 80, 70, that one is a clear indication that you are responding well to treatment. But there is no change, and the marker is writing within your system, then it indicates that you are not responding to treatment and you are getting more ill. So more investigations need to be done and change of treatment to try and find out what must be causing all this. Our second marker, we have the erythrocyte sedimentation rate, which measures how fast your red blood cells settle in a tube. So we normally have a tube where that is labeled. We placed your cells inside there and we time it for 1 hour. So your normal ES level is normally below, say 20, around 10, yeah, below 10. So your red blood cells, a normal blood will settle at a slower rate. But when your blood is attacked and you have an infections such as anemia, things like anemia or just other infection, your blood will tend to settle very fast and your ESR levels will be things like above 50, 80, 100, and that one will be a clear indication that you have an infection, and investigation needs to be done to find out which specific infection do you have so that treatment can be considered. ESR is as well non-specific but useful for monitoring chronic inflammation. So these inflammatory markers, most of them are non-specific, but they're useful in some specific condition. Like, for example, when we said CRP was a general one, but for ESR, it's good for monitoring chronic infections. Our number 3 and commonly ordered inflammatory markers is the PCT. You will see the doctors say you go and do a test called PCT. PCT is just mean procalcitonin. And procalcitonin is a precursor of a hormone called calcitonin. Calcitonin is a hormone that helps in calcium metabolism within your system. But in this case, we are using procalcitonin as inflammatory marker. And it's normally more specific to bacterial infection as opposed to the others. So when your doctor suspects you of having a bacterial infection or your condition might be caused by a bacteria, your doctor will prefer a procalcitonin test, that is the PCT, because it helps. Its most advantage is that it's helping distinguishing whether you are having a bacterial or a viral infection, and it's a good one in monitoring antibiotic therapy, or when you are placed under antibiotics, will check your PCT level maybe on a daily basis to try and monitor how well you are responding to treatment. Of course, when the PCT keeps reducing, that one is a good one that you are responding well to treatment. When it is not, then something more need to be done to find out where the problem is. Maybe wrong diagnosis, maybe resistant to treatment, to the drugs that you are using, or maybe your condition is worsening. The fourth one, we have the ferritin, which is an iron storage protein, but also an acute phase reactant. Don't worry about those. It is high in infection, inflammation, and cancer, and always low in iron deficiency anemia. Now, most of you have heard about something called anemia. Iron is one of the substances that help in the formation of the red blood cells. So when it's low, automatically the formation of red blood cells is affected. That will cause anemia. And when it is high, it can signal both iron overload and inflammation. So our clinical use, mostly for these inflammatory markers, they help us in diagnosis, general diagnosis of infection. So the moment the levels are high, it indicates that you have an infection, and we had the doctor to continue doing more investigation and come up with a clear diagnosis. They help in tracking your response to treatment, and they also help in differentiating between bacterial and viral infection, and that's in this case mostly the procalcitonin. Our take-home message today is that inflammatory markers just give us clues, not final answers. You just do them to confirm that you indeed have an infection, and you need to do other more specialized tests to confirm the specific infection. Must be interpreted with other history, of course, the patient's history, and other exam findings such as various scans, and is used for monitoring trends and not signal. Thank you for your time, and let me know in the comments what test you want us to discuss in our next episode. Thank you, and keep following and watching.